40 other states, you say, do something like this.
Similar.
And this is a way to inflate local costs so that the match from the feds goes up.
Right.
In these 40 other states, do they call it a fee? Do they call it a tax?
It's called a tax in every other state. The feds call it a tax.
And because we have the Taxpayer Bill of Rights built into our Constitution, and anything that is a tax, we need a vote for it.
Right.
And there is no way that people are going to vote to pay another 5% on their health care costs.
Right. We know that.
When this went up, and I wish the sponsors were here, when this came up, particularly on the issue of transparency and the issue of letting people vote, that this is called a tax in every other state where they do this scam, and it is a scam, what's the response? I mean, are there people who say this is good government, we want to get more service here, and this is the way to do it?
There was actually one person who made the argument that because the feds are paying this money out, we owe it to the taxpayers of Colorado to make sure we get our share too. And that's when I stood up there and said, this is just shameless. We are breaking this country. The federal government is broke. We're going to run up a greater debt in the next 5 years than we have ran up in the whole 230 previous years that this nation has been in existence. And this bill is piling on.
This is just a way to scam the federal system.
Oh, it's terrible.
All right, so let me see if I've got all the parts. At the end of the day here, we've got a tax increase that is not transparent. It's not put there. At least when I get my grocery bill, I can see tax on the bottom. Doesn't have that on it. It goes to the hospitals, and it will provide more insurance, more coverage for a lot of people, but you're telling me there are much more effective ways, if that is the goal to do so, than spend the $630 million a year. Let's go to the other side of the equation. Those of us who pay a lot for private health care, and I pay a lot for private health care, and it's been worth it. I'm glad I've had it. Our costs, should we go to the hospital, goes up 5%. Do we get any benefit?
No.
So there's no reimbursement to us.
Actually, you're harmed by this because buried in this legislation is funding to help hospitals go along with state quality mandates. And some of these quality mandates are pretty pernicious and are likely to degrade your medical care.
Quality mandates,
quality
just
is always
like
good.
Healthcare Affordability Act sounds good. So tell me, so part of this money, I get none of this back.
Right.
So while this is nothing more than really a way to tax me, use that money to leverage more money coming from the feds, use all of it to give people who don't have health care coverage.
No, they have health care coverage.
Don't have.
To let people
insurance.
switch from private insurance to state insurance. Most of these people have health care coverage, at least if the data are to be believed.
Tell me about this quality control.
Well, just the state thinks that if it has certain measures on hospitals that they'll give better patient care. And Medicare is encouraging to do this. And some of these quality measures are ridiculous. They're things that will make doctors make decisions not to treat you because they might develop pneumonia. And if you get pneumonia, the hospital doesn't get paid, something like that. So it's better sort of not to treat you aggressively because you might not get pneumonia, and, well, we wouldn't get paid for that. So these kinds of quality measures, there's a lot of problems with these. So yes, you get nothing for it, and you might get less than nothing.
So for those who pay for private health insurance, 5% increase every time you go to the hospital, we get nothing for it, nothing.
Yep.
Governor's going to sign this.
Yes.
Everybody's going to love it. It's going to be a step towards universal care here in Colorado. Is there any talk of just taking the big step? And if we're going to socialize, why do it bit by bit? Let's just jump off the cliff and all do it at once.
There's actually a bill working its way through the House right now seeking to do just that. I don't remember the number, Linda May, but the left is attempting that.
Well, at least that would be much more honest than this, wouldn't it?
You appreciate that honesty, don't you?
I would like to have that fight, then every year do another bit of this. All right, let's talk about the tax versus fee thing. Okay. Let me go through this. Let me see if I understand this. So we've got this, which is $630 million a year tax increase. We've got the FASTER legislation, which are car taxes at $250 million a year each and every year. We've got the mill levy freeze, which when it was done looked like $2 billion, then went up to $4 billion for first decade. Marriage fees, court costs, And now there's also talk about removing the cap on our 6% limit, or the 6% bird arbor limit, so that we can spend all this new money we've come in, because we have
Right.
one last limit in place which says we can only spend 6%,
Right.
which is ridiculous because now we've got a budget deficit. We're worried about getting to 0% growth, not 6%. Where does that stand?
That has passed the Senate and it is sitting in the House waiting for further conversation, as they say. But this hospital tax is going to drive a massive problem there under both Tabor and Arbor-Scow-Bird, because it's a $600 million, they call it cash fee increase, which down the road someday, unless they dismantle Tabor completely, could drive tax refunds out of the general fund. It's going to cause a lot of problems.
So because of this, really in the future, they're going to need to get rid of the bird arbor 6% growth limit.
This is going to give them the ammunition that they need to get rid of both Tabor and Arbor-Scow-Bird.
It's a beautiful plan, isn't it?
It's a beautiful plan. These guys are pretty sharp about this. There are think tanks that exist for the sole purpose of dismantling Tabor. This is one additional step in that direction, besides being socialized medicine, which ruins it for everybody.
All right, give me an alternative here. We've got a couple minutes left. If you could put the governor under truth serum and say, you realize this is a scam, you realize everybody else in the world calls this a tax, you understand what you're doing here is unconstitutional, and just because Mary Malarkey and the Supreme Court will do your bidding because it's against Tabor, you still know it's wrong. Here's a better option. What's the better option?
The better option is to look at a serious reform of the state Medicaid program, and to have a public discussion about who you should concentrate public funds on. Should you concentrate it on people who need expensive care in order to survive, or should you concentrate it on physicals for children? What we've seen happening is a big expansion in coverage, state taxpayer-supported, routine care for healthy people. In my view, that's not an effective use of taxpayer dollars, and that needs to be redone. We need to experiment much more in the state with sort of voucher programs that are consumer-directed. The Colorado Consumer-Directed Attendant Support Program has saved the state 20 to 30% on care for very, very sick people. The state has not expanded the program to other areas, and that's just a dereliction of duty. There's a lot of money to be saved in Medicaid.
So in other words, those areas where you give people direct cash and
You
say,
make
instead of
them
having the
free.
bureaucracy
Yes.
tell you who's going to take care of you, here's some cash. Go off and act like a rich person and buy what you want.
The care that you need.
And that means you can hire people that are responsive to you instead of dealing with the Department of Motor Vehicles like Medicaid, Medicare
That's
system.
Right.
Well, this is likely to happen, isn't it? This could happen.
In your
Get
dream.
on it. What's stopping that honest conversation from happening?
There are too many liberals holding elected office in the Senate, the House, and the first floor at the Colorado Capitol.
It's not just
really.
liberals. There are several lightweight R's here signing on to this tax
I
increase.
did not say Democrats, I said liberals. And you really do need to have people who are bold enough to want to experiment in systems that allow the market to work. Because, as I said earlier, Coloradans make great decisions when they're given the opportunity to choose correctly. When you give them the opportunity to choose something for nothing, they'll take that every time.
But this ain't something for nothing. It's just that we hide the costs without even putting it on there. Senator, thank you. Linda, as always, thank you. And most importantly, thank you. Check out our webpage, independenceinstitute.org. Listen for me late nights on 850 KOA. If you're looking for a good podcast, it's ivoices.org. And please, tell a friend. We'll see you next week.
You jibber jab, bamboozle, nuka, noozle, bippity bop, she-gall. You jibber jab, bamboozle, nuka, noozle, bippity bop, she-gall. I mean, you keep on talking, but you don't know where to turn it.